This is a morning routine that I do for lower back and pelvis to improve stability. Start by doing your pelvic tilt. So I'm going to roll this up like this. So you tilt your hips back, and to do that you put your hands in the small of your back and you tilt your hips back, the pelvis back, and come back again. And you do that 3 times, and you work with your stomach as you go. You just tilt the pelvis back and down, and again down. Really work your stomach muscles. All the powers come from here. You do that 3 times, and then the second time, or the 4th time, you go a little bit higher. So you push your spine, you tilt the pelvis a little bit more, push your spine a bit more, and go back and feel like you're pushing one vertebra by the other up like a cogwheel. And you do that 3 times, and your stomach muscles are really working doing this. And when you've done that 3 times, you go up to the 3rd level. So you go a little bit higher and you push your stomach muscle down and convex your spine all the way up, so almost the bum is coming off. And then the same thing down. You roll down 1, 2, 3, and you do that 3 times. Work your stomach muscle, deep, deep muscles. Tilt the pelvis, almost lift it up, and come down 1, 2, 3, really slowly. Let's do that one more time just to be sure. Tilt the pelvis, work your deep core muscles, come all the way up to the top, and then slowly curl down 1, 2, 3. Then we're going to do the clock, and the clock, what you do is you tilt up towards you, you tilt to the left, you tilt down to this pubic bone, you tilt to the right. So you can think of it like 12, 3, 6, and 9. And you do that 3 times, up, left, down, and right. Again, up, left, down, and right. And then we do the other way. You go down, left, up, and right, down, left, up, and right. And one more time. Try and relax your neck when you do this. Down, left, up, and right. So small, tiny, tiny movements. Then we're going to do a sacroiliac mobilization. So you're just going to bend gently. If you put your hand like this, imagine your sacrum is below. Just going to lift up on the right. So you squeeze your right buttock muscle and come down. Squeeze the left buttock muscle, come down. But you don't want to do the whole pelvis up. You want to be very localized just here. So lift up and down, lift up and down. And you should be able to feel if they feel equal or if one of them feels stiffer than the other. So you do that 3, 4 times. And one more time, to the left and to the right. And then you bring your legs up, you swivel around, a few times one way, a few times the other. Then you put your leg in front of the other like a figure of 4, bring it up towards you and stretch out to piriformis, hold it there, breathe in, breathe out. If you can go a little bit to the opposite leg, so you stretch a little bit more, bring it back and down, same thing, bring this up, hands around the thigh, lift up and hold, breathe in through the nose, breathe out through the mouth, go a little bit across and come back. And if this is available to you, we have a happy baby for your hip flexors, where you put your hands on the inside of your feet and you hold your legs like this. If you can't do that, just hold your hands on the knees, but just hold that stretch and come back. That's lovely. Thank you.